Welcome, everyone. We're going to wait a couple of minutes while people join, and then we'll get started. Hi, everyone. Welcome. We'll go ahead and get started today. Thank you so much for joining us for the extended virtual family week presentation on the College of Health. I'm Beth Dolan. I'm the interim dean of the College of Health. I'm very excited that you're joining us virtually. So you can see behind me, there's the beautiful new Health Science and Technology building, which should open in January, and that'll be the home of the College of Health. And I'm joined by my colleagues here today, Rick Birchfield, who's the Director of Marketing for the College of Health, and behind him, I believe he has the Alumni Memorial Building, which you may recognize. And luckily, two students have joined us as well. So Chrisanna Gohl is here, and she's, I think that's the UC behind her. Yay, so it's a little bit like you're on campus. And then Leanna Moscos, is that the chapel behind Leanna? I think so. Yay, okay, good. So we have a little bit of Lehigh on the screen. Just a couple of housekeeping things. We are being recorded today, and that recording will be available on the Family Weekend website starting next week, and you'll be able to access that for the next 2 weeks. Or if you know people who had to miss this live, then they can certainly access that recording. Also, we are going to save time for questions at the end, and we invite you to go ahead and enter any questions that you have in the Q&A. If you would use the Q&A instead of the chat, it'll be easier for us to manage the questions. So that would be wonderful. Feel free to put them up at any time they occur to you. We won't get to them until the very end, but that way you can just write them down when it's on your mind. So I wanted to offer you an overview of the College of Health and what's offered in the College of Health, in part because I'm not sure, who's with us today and how much you know at this point. So if you have a student in the College of Health, and some of this is repetitive, I apologize, but I found as a parent myself of a college student that there's a lot I didn't know. Until I sort of maybe went to an official event, and you'd always learn stuff. So including opportunities for your students. So let me get started. Oops, sorry about that. So why a College of Health? So Lehigh started the College of Health in 2020. So we're in our second year. And part of the reason there is that to meet the challenges of the moment. So, Lehigh opened in 1865 in part to participate in the Industrial Revolution. And here we are in 2020. And although the College of Health had been planned for a long time, nothing made it more clear than a College of Health focused on determinants of health and population health, community health would be important, right, than COVID. So COVID made that very clear to us. Beyond that, though, the College of Health's purpose is to offer both students in the College of Health and students across the university access to this really huge part of our labor market. And so currently there are almost 1 million companies, nonprofits, and government organizations that focus on healthcare in the United States. So that's a huge number of potential employers. And employment in healthcare occupations is growing and predicted to grow 15% over the 10-year period, 2019 to 2029. So we want Lehigh students to have access to those jobs. That's part of the motivation for sure. We're doing that in 3 ways in the College of Health. So we offer an innovative curriculum. We try to incorporate experiential learning in students, curricula all the way through. And then we also integrate career and professional development into the curriculum. So I'm going to take each of these in turn and just do a little bit of explanation of how we're implementing them, and then give you some examples of student experiences and turn it over to the students. So first of all, as you might know, we're going off the rails here. I have no idea why. Okay, so we offer 2 majors. Sorry about that. A BS in population health and a BA in community and global health. The BS in population health, as you'll see here, I'm having trouble advancing for some reason. Oh my God. Sorry. There, the BS in population health is it's data science centric. So the data science sequence is a really important part of the population health major, where students learn they learn biostatistics and they learn how to solve real world kind of data issues using programming. They learn both R and Python, at least an introductory level of R and Python, in order to create and run biostatistics programs. They also take 2 courses that are focused on determinants of health. So determinants of health are the upstream causes of ill health and wellness. And so we want students to know in this major not only how to analyze data, but to understand the significance of those data in terms of the social setting. You can see that this is a highly customizable major. So students have concentration electives that they can take up. And they also have a capstone project where they do independent research. So let me see if I can go back. Okay. I am just going to drive this way because it's going to be a lot easier. So going back to the BA in community and global health, this is a more applied degree. So students who are in this degree program will learn, first of all, they'll take a deeper dive into the determinants of health. You'll see instead of 2 out of 3, they're taking all 3 as part of their core requirements. And they also will do a field experience or practicum. And they'll get familiar with sort of the culture that they want to study or they want to work with. When they finish this degree, students will be able to identify particular issues within communities, health issues, work with the communities to identify those issues, and then design an intervention, implement that intervention, and assess that intervention. So it's a very hands-on kind of degree. We also offer minor programs, and this is where we really reach out across campus. And so students can minor in population health, global health, Indigenous peoples health, and maternal and child health, no matter what program they're completing across the university. And of course, students can just drop in for a single course in College of Health too, which does happen a lot. We actually, in our classes, we are educating, in our classes, 64% of the students in our classes are actually from other colleges. So that shows that the College of Health is already having an impact and offering opportunities across the university. We also offer something kind of special in the College of Health. If students complete the BS or the BA, so either population health or community and global health, if by their junior year they have a 3.5, they're automatically accepted, if they want to be, into any of our master's level programs. So that's the MPH and the MS in population health within the College of Health. And then we also have partnered with the College of Engineering to offer the same 4+1 arrangement for the MS in healthcare systems engineering. So there are a lot of directions that students can go by just adding this 1 year. These are all generally 2-year degrees, but they can accomplish them in 1 year with the 4+1. 3 kind of big pluses here. It's easy in a sense, there's automatic acceptance. You'll complete that master's program in half the time that it normally takes. And for the College of Health programs, we offer a 20% discount on the graduate tuition. So it's something to keep in mind for students and parents as you go through the programs. We also are launching graduate programs starting in the fall. And so we have certificate degrees, which are basically about 15 hours of coursework in population health and global population health. Master's degrees, which I've mentioned in the 4+1, the MS in population health, which again is going to be very data centric, and the master's in public health, which is a nationally recognized degree and really the degree that you need to enter into the public health field. And then we'll also launch our doctorate in population health in the fall. In summer 2023, we will be offering a dual degree program with the College of Business. This is actually it's an 18-month, we've slimmed it down from 2 years, MPH and MBA together. And we will offer the healthcare management concentration in the Flex MBA at Lehigh. So more good options, even for perhaps students or grown-ups, who may not be currently enrolled in the College of Health. So what makes all this happen, all these classes, it's our faculty. So right now we have a small but mighty faculty. We have 11 faculty members. They're epidemiologists, community health specialists, biostatisticians, health data analysts, medical anthropologists, environmental scientists, specialists in healthcare quality improvement. So we have sort of a wide range in this small group, and we're hiring. So we'll be making 9 additional faculty hires this year, and the next year and the next year until we reach about 55. In addition to that, students in the College of Health have access to 50 plus faculty from across the university who are affiliated with the College of Health, which is really exciting. So there's a really nice health footprint at Lehigh already that the College of Health is collaborating with and leveraging as we grow. You may have heard that we also have a distinguished scholar in residence this year in the College of Health. This is our first time to have this person in this role. So this is Joan London, and the parents out there might recognize her name. I know no one in their 20s knows who she is, but if you're my age, you may have grown up watching her on TV. And so she was on Good Morning America for 20 years. And Joan London is teaching a course for us called Population Health in the Media. And although students may not have heard of Joan London, they will recognize many of her guests who are major figures in population health media. She's really interesting. That course is actually available to alums, parents, anyone who wants to join on Monday, which is the day that Joan interviews people. You just have to register through Alumni Relations to join in and see what's going on there. I watch it when I'm able to, and I don't have meetings, and it's really interesting. So the course is basically kind of a TV show on Monday, but in person, and students get to ask the questions along with Joan London. And then Wednesday is a discussion section. So that's our innovative curriculum. And let me move on now to experiential learning and just give you a quick overview. So one thing that students do in the realm of experiential learning is research with faculty. So even in their first year in the College of Health, and even in the College of Health's first year, students were very involved in faculty research, including research on the topics below, or the topics that you can see on the slide. So everything from health journalism to epidemiology with a focus on liver cancer. So it's really exciting for students to be involved in faculty research. And if there are any students who are listening today and you're like, wait, how do I do that? You just contact the faculty. That is the way to do it. Just ask. Our faculty are really excited to work with students on their research. Part of the structure for that are our institutes. So we have 2 research institutes in the College of Health. One is the Institute for Indigenous Studies. This is a very well-funded institute, meaning they have a lot of research grants that they're working on. They actually are first in the nation in terms of treating addiction among Native Americans, and first in the nation in terms of success with smoking cessation. So it's a very well-developed kind of set of research programs that students can be involved in. I know last summer they had 12 students working with them, for example. We also have an Institute for Health Policy and Politics. This one's new, just got approved, and it's really exciting. We have right now 2 world-renowned health policy experts on our very small faculty, but they are amazing. And so this is an opportunity for students to understand how policy gets made, to actually engage in helping to create and push for policy change. And so that's another really exciting opportunity. So if you were to major in the College of Health, what would you do with one of your degrees? Just want to talk very briefly about that. I think the challenge is that there's so much you could do with these degrees that we want students to try to start thinking about that while they're in, while they're sophomores even. And by that, I don't mean we want them to decide. What I mean is we want them to explore, and we want to support that exploration. So that they can figure out how they might fit into this landscape, whether it's a domestic, purpose-driven domestic career or something in global health. So just an example of sectors, students who graduate from the College of Health could work for private or for-profit entities, including hospitals, pharma, startups, et cetera. They could work in the nonprofit sector. I think sometimes people don't always think about this, that you could be a grant officer for the Gates Foundation, for example. That's an interesting direction to go in. And in terms of hospitals, I should have mentioned this, but we are very friendly to pre-meds, and we really think we have some great majors for pre-meds, and they are you're able to accomplish them with the pre-med requirements as well. So others, government is obviously a place that students can work in, and then U.S. federal agencies, the Congressional Budget Office. They need experts who understand healthcare, who understand the costs associated with healthcare. Okay, so let's talk more about careers and how we integrate them. So one thing that we do is we bring alumni who are working in the healthcare field into our introductory classes so that students can experience kind of a variety of career paths and just sort of start thinking about them and hear from alums. So the Healthcare Alliance is one of the alumni groups at Lehigh that has adopted our students as they've offered to be the alums to our students, because our students don't have alums yet in the College of Health, which is really cool. And so they're really anxious to be involved with students. It's kind of amazing to me that in the first year that we're in existence, students had a number of really fantastic internships. Some of them, and you'll hear about this from Krisanna, found these internships on their own, and some of them found them through the College of Health or through the Center for Career and Professional Development at Lehigh. One thing that we're committed to is helping to fund internships. If a student gets an unpaid internship that's very relevant to their degree, we're hoping to be able to provide some funding for students in those unpaid internships. Other students will find paid internships in industry, and that's wonderful too. I love hearing from students. Students are in this with us, helping to build a college, which is an exciting opportunity. I learn something every time I talk to students. And so we have a couple of mechanisms to make sure that's happening. One is the Student Advisory Council. I have a meeting this afternoon with them. Liana's on that council. And so we'll be talking about this year ahead. We also have student ambassadors. These are students who help with admissions and recruitment. And then once a month, we offer a student roundtable where students can just show up and chat. Or last month, we toured the HST building together, which is really neat. So there are lots of opportunities there. So that's all, just a quick overview. I would invite anybody to reach out to me at any time, not just obviously through the Q&A right now, but by email if you have additional questions. I want to turn it over now to my colleague, Rick Birchfield, who's the Director of Marketing in the College of Health, and to the two students who have joined us today, Krisanna Gohl and Leanna Moskos. So Rick, do you want to take it over and get these guys to introduce themselves?
Absolutely. Thank you, Dean Dolan. And again, a reminder, if you do have any questions, please post those to the Q&A and we'll make sure that we answer them to the best of our ability. Also in the chat, while Dean Dolan was talking about the Joan London class, I put the link to the registration there. So if anybody is interested in that, that is also there. So please do continue to ask questions. Really excited to introduce our students. So Krisanna, I don't know if you would like to do a brief introduction to everybody who's watching and tell them kind of a little bit about yourself, how you got to Lehigh and how you got involved with the College of Health.
Hi, so my name's Prasanna. I'm currently a senior here at Lehigh. I'm double majoring in psychology and health medicine and society, which are both in the College of Arts and Sciences, but I decided to pursue a population health certificate as a minor in the College of Health, just because I thought it was more of like the data analyst side of what I was doing in my health medicine and society major. So it was really great to put those things together. And I talk about all of my population health classes in my health medicine and society classes and vice versa. So it's really great to just get all of those different like interdisciplinary views on everything that I'm talking about. And then I'm from Maryland, so I've lived pretty close to Lehigh, and that's kind of just how I found the school in general.
Great. Thank you very much for that. And Liana, would you like to also introduce yourself and talk a little bit about your background?
Hi, my name's Leanna. I'm a sophomore. I'm in the college, both in the College of Health and in the College of Business. I'm doing a dual degree in accounting and doing the BS in population health. I've really found the data analysis side of population health to be extremely helpful, coupled with business. Potentially, like I want to do something in healthcare administration is what I'm thinking right now. And I am from Fort Lauderdale, Florida.
Great. So we have two out-of-state students, so that might be something that we can talk about at some point in time. But Leanna, one of the things you mentioned was the double major, and I'm sure there are a lot of people on this call are kind of wondering, what goes into that? How difficult is it? And knowing about the College of Health, that it's very interdisciplinary, working together in different fields and learning about different majors is really going to help you as you once you graduate. So can you talk about how you've juggled that and what brought you to that decision to be able to say this is what I want to do?
Yes. Well, initially I was pre-med, but I decided that I wanted to switch into the College of Business and do a dual degree, just because I felt that a background in both would just help me have like a broader perspective on things. And also I wanted to do something that was related to the healthcare field, but not like directly like be a doctor. So I decided that a business background would be helpful to be successful. And there's like also like some accounting firms that do focus like on healthcare in particular. So that's why I decided to do both. I actually met a man that works for ECRI, and it is like a healthcare accounting firm. So I'm actually interested in doing something with both.
Very nice. And actually, that sounds like an endorsement for the dual masters with the MBA that Dean Dolan was talking about too, because obviously that's the next step in that as well. So thank you for that. Another question, Prasanna, Dean Dolan talked about your internship and how you were kind of able to, be proactive and find that. And it sounds like it was a great opportunity. Can you talk about how you found it, and then some of the work that you were able to do?
Mm-hmm. So I guess usually like at Lehigh, I think that junior year is when a lot of students start looking for summer internships. Up till then, at least in my personal experience, a lot of students either choose to do classes, study abroad, or just are like working in different fields that don't really have to do with their major. So like during my junior year, I was very like set on finding a summer internship. I was using LinkedIn, Handshake, which is what is run by Lehigh, as well. And it just kind of, I stumbled upon like a public health internship with that would combine both psychology, health medicine and society, and my background in population health with the classes that I've taken so far. So I just applied through LinkedIn. It was a really easy process. I just needed a few letters of recommendation, which was, as a junior, I had already made connections with a few professors that I could ask for that, so which is really important to go to office hours and just stay after class, get to meet your professors, and then I'm sure they'd be more than happy to help you out with a recommendation. And then, so this summer, Alidate as a company, basically their main goal is to expand like health outcomes for people that are on Medicaid, which is government funding. So they're a private company, but they work very closely with the Medicaid system. So I was mostly working in outreach, where I was looking into different physicians' practices that would then work with Ality to help save both the physician's money and also the patient's money, but then lead to better outcomes in the patient's health. So I had a really great time doing that. I learned a lot about how healthcare works as an entire system, and just a lot about the company. Ality takes summer interns every year. A Lehigh alum actually works for the company and reached out to me when I was working there as well. So hopefully we can continue to have Lehigh students intern with them. And so after that, I really just got to learn a lot about the different aspects of the company. I was in outreach, but I talked to people on the legal team and marketing team. They even have their own accountants and different finance people as well. So I really got to learn a lot about different parts of the just the field of healthcare and what different majors and education careers can be a part of that. And I decided that I wanted to continue pursuing health law. So I'm pre-law right now, applying to law schools, but definitely using everything that I learned both in the College of Health and the College of Arts and Sciences in my applications and my future career.
That's fantastic. And, that's why, experiential learning is very important always, but, so much so in the College of Health. We actually had an event, our students know this, but we had an event on Thursday of this past week where students were able to present. They had posters for some of the summer experiences that they had. And actually, if any of our parents were there for Parents Weekend, we left them up in the STEPS building. So hopefully you were able to see those, and we appreciate everybody who was able to do that. I have a question that just came through. Let me see. Okay, here we go. Beth, this is probably a question for you. So the question is related to, it says that their family has enjoyed checking on the online cameras and watching the building of our new building, which isn't just for College of Health, but it's our home, and we're excited about that. They want to know if classes will be taught there this year, and will the students be able to study there. And the comment is that it looks amazing, which I can definitely attest to. Yes, it does look phenomenal. So Beth, would you like to address any of that?
Sure. Yeah, I've had the pleasure of being able to tour it as it's been, several times as it's being completed, as it's being built. And so it's been so exciting. I totally share your excitement. I think it's really cool that you found the camera to watch it. To answer your question directly, we hope that it will be ready for occupancy in sort of November, December, and then be ready to go in the spring semester. And so yes to all your questions, but let me say a little bit more about it. So the Health Science and Technology building is Lehigh's biggest building that Lehigh's ever built. It's not as big as the Iacocca building up on the hill, right? Up on the mountaintop. But Lehigh didn't build that. Bethlehem Steel built that. So this one is the biggest one that Lehigh's ever built. One thing that's really cool that I love about it is that it's also the only building on campus to face the town instead of to face in toward campus. So all of our buildings kind of turn their back on the town, if you will, with the signs on the inside. So there's a huge Lehigh sign that will be facing North Bethlehem. You can actually see it from across the river, which is neat, and it will be lit up. It's very classy. It's not like neon, but it's very cool. The building itself is full of glass and steel and wood and plants. So the plants aren't in yet, but they're all these like very deep planters so that we can actually plant trees and stuff inside because there's so much light in the building. It has an enormous amount of glass. And you can't see it in this picture, but there are shades, metal shades, to sort of diffuse the light, especially, on the south side. And it's, those metal shades are actually shaped like they're sort of an internal cell structure. So they're very cool. There's all this like aesthetic that is sort of that's related to science. The building is primarily a research facility. And so there are labs on every floor except for the first floor. And the first floor is where the College of Health will be located, where many faculty offices, the administrative unit for the College of Health will be there. And we have a huge conference room that we control. There's actually 4 or 5 conference rooms per floor. And faculty offices are in the middle of the building instead of around the edges on the windows. And the idea is collaboration. This building is all about collaboration. So there are scientists from the College of Arts and Sciences in that building, and there are engineers in the building, and then of course College of Health faculty in the building. So the idea is that there'll be a kind of collaboration among faculty in terms of research. And of course, there'll be opportunities for students there as well. So we're planning to use that large conference room, for example, for upper level upper level courses in the College of Health. There are not any classrooms in this building because it's a research building, but we can use the conference room to hold classes that will fit in those rooms. There's tons of amazing study space, tons. So there are cantilevered corners, and I'll stop talking about this in a second, but I'm pretty excited about it. There are cantilevered corners, meaning there's no post on the corner and it's all glass. And those corners, they're sort of on 3 different floors, I think, are just a space to hang out. So people can just go there and, bring their laptop and work or read or do whatever. And then there are workstations all over the building. So all kinds of little areas for collaboration, like small conference rooms or, seats where students can just sit and study or do computations. So there's so much opportunity here. It's really exciting. So thank you for asking that question.
Yeah, it's great. And, I got to take a tour. I started in June with the College of Health, and I got to take a tour. It was amazing. And if I'm not mistaken, Dean Dolan, you were able to take some of the students recently who were on the advisory council over there. And I think that's a good segue to a question for Leanna. I believe you're on the Dean's Advisory Council. And would you be able to kind of talk about how you got involved with that and what you feel like you get out of it and what you think the college also gets out of that as well?
Yes. So last year I got an email from Dean Dolan, and she asked me to be on the committee. So basically what we do is just collaborate between like the students, faculty, and we're able to just communicate about just like different things that we feel to improve the college, as well as like feedback from other students. So we get like both perspective from the faculty as well as like the student side.
It's fantastic.
And one thing that came up last year, I just actually got confirmation of this, Leanna, which we'll talk about this afternoon, but when we meet, the students last spring asked if they could be in charge of the process for naming the cafe in the HST building. And I finally got an answer actually today that yes, the Student Advisory Council and the College of Health students can be in charge of that process. So anyway, we'll talk more about that, but that's really exciting.
I've got another a note about being very excited about the new building is going to be online as we all are. So I'm glad you're excited. I'm sure your daughter's excited too. I'm very excited about moving over there as well. So thank you for that. And then so Chrisana, I was going to ask you. You said I think you told me that you're a tour guide. Is that correct? So I know you're graduating in May. Is that when you're graduating? Okay. So the College of Health was something that started while you were already here. How's the excitement kind of been about having a new college like that when you're on the tours? Has that come up at all? I know last year was a little bit different, of course, with the fact that we had COVID, keeping everybody off campus. But what's that been like for you?
Yeah, it's definitely been very exciting to talk about a new fourth college. I know that population health as an undergraduate degree is something that is very unique to Lehigh and only a few other institutions. So that's always like a great selling point. And I also think that it's just been really exciting as for students being here. Like I came in before it was even announced that there was going to be a College of Health, and I am very fortunate enough to like be able to continue taking classes in it, even if I can't do a full major. But a lot of my friends that are like in different majors continuously ask me about my classes. I have a few other friends that are also graduating seniors that also got to pursue a minor in the College of Health as well. So I think that it's just a lot of excitement all around, both on campus and people coming to campus, getting to learn about that.
That's great. No, and no one asks for a pandemic and no one wants to deal with one, but it as we discussed earlier, it definitely underscores the need for the College of Health and what it's doing. To that end, Dean Dolan, I don't know if you want to talk about what's it been like to be able to really get to welcome the students. We're all wearing masks and being as safe as possible, but you're actually able to interact with the students this year and in person. So how's that been for you?
Yeah, it's amazing. The students are why I am an educator. It's such a privilege to work with people in this age group who are, I think we who work with the students at Lehigh learn as much as we teach, because there's just so much you're bringing to the table in terms of cultural trends, like around gender. So much has changed, it's just really interesting to learn about that. And just the view of the world from these students is incredible. Lehigh students are really special. And so it was a huge honor to be able to step into this role. And one of the first things I wanted to do was to meet students, and we were virtual. And so that was a bummer. So I was so excited that we had a welcome event the first week of classes. And students turned out for that, which was wonderful to meet people. The president spoke, our new president, the provost spoke, and then we just visited with people, which was fantastic. We also had, as Rick mentioned, an event last week that was focused on internship opportunities for students, where folks who had gotten internships came out and shared their experiences, how they found them, what they did, or if they did research with faculty, so that everybody can keep learning about that. And I just had a meeting yesterday with a student who's on the Student Advisory Council. So we'll be talking about this afternoon, but he had like 15 ideas for social events this fall, which is awesome, in the College of Health. I mean, we're not going to be able to do all of them, honestly, but he had some really, really cool ideas. One of them I love, which is a dinner, kind of a more formal dinner between the Healthcare Alliance alums and the College of Health current students. What a great idea. I love that. So that would be a fantastic thing to do. He also was really interested in having a pacing break social where people design t-shirts for the College of Health. I think he's reached out to Rick about that. And he would love for us to host the creators of a podcast that he loves called This Podcast Will Kill You. And I listened to it on the way in. It's a very good podcast. Actually, it's really cool. It focuses on a disease per podcast, and they have like 100 episodes already. Wow. And it's an MD and an MPH who giggle a lot because they like what they're talking about just cracks them up, even though it's so disturbing, actually. Right. But it's really interesting. So today's podcast I listened to is on prions. Anyway, so I mean, I'm really open to student ideas. I think that's what brings the energy and the excitement to the college. So I just can't wait to see what we're going to be able to do together this year.
Yeah, I've enjoyed it, definitely, from orientation all the way through, and I know you have, and so of the faculty as well. And again, everybody, please remember, we're happy to continue to answer the questions, so keep on posting them. I do have one. One of the things we say in the College of Health is that zip codes sometimes are a better indicator of the general health of a person than some other indicators. And to me, that was, it's very surprising. If it's not something that you deal with or look at every day, you may not understand that, you may not know that. So for the two students, I'd like to kind of know, in your experience with the College of Health, what's the, one of the most unique or interesting things that you learned that either you had no idea about, or you're just, very interested in helping to solve a problem in the future? I don't know, Leanna, you want to start?
I'm sorry, you're talking about just as far as classes?
Yeah, and it through your classes or through interaction with your professors. It doesn't have to be in the classroom per se. It could have been something else, but just, whether it be a fact or, again, something that just kind of stuck out to you that, was enlightening and something that you, are hoping to maybe be able to tackle.
So as far as classes, my favorite class is the BSTA, which is the biostats class. And I found it like really interesting because with COVID, I were able to take the data from like certain websites like the CDC and incorporate it with the things that we learn and statistics, and we are able to code it through R. Currently, we're doing R. Last semester we did Python, but I found that very interesting because I've never taken a coding class. But I just think it's really cool how we can take all this data, put it with like different equations into graphs, and we can analyze the data through that. So I found that extremely helpful.
That's great. And Chrisana, what anything that sticks out to you?
Yeah, so I guess I kind of have two answers. I also really liked the BSTA class, and it was very kind of like eye-opening to me. I'm a psychology major, and whenever I thought of Python, I would only think of like my computer science friends, and then I was having to learn Python and getting to do really cool things with that were very applicable to all of my majors combined. So I thought that was really cool. And then I took a class with Dr. Wakil, and she does research, I believe, in like maternal health and childbirth. And in the class, it wasn't necessarily focused on that, but she would relate a lot of her research to the class, and I learned so much about this like other topic that I was not taking a class on. And then we got to relate that to like our own personal experiences, thinking about like our families and our communities. And I think that a lot of the things that you learn in the College of Health are just so eye-opening because, well, some of these health issues might not apply to you directly. It's so easy to then put yourself in the shoes of people that they might apply to, and then think about all the things that are affecting them, that like you're either so fortunate to not be affected by these things, or that are then happening in your community, and what are ways that you can kind of eliminate that and help others, which I think is really cool.
Yeah, no, that's something that struck me, and one of the reasons I wanted to join the College of Health is I just, that mission is so amazing. And our students are going to be able to come in and they're going to be able to get great jobs, but they're also mainly going to be able to help people, and that's what it's all about. So that's why I was so interested in it, why it's amazing to me. Dean Dolan, do you have any questions that you would like to ask the students, that something that you've kind of been thinking about?
Yeah, I mean, I think it's amazing that you guys are involved in building a college. Like very few people who graduate, when you graduate in May, Chrisana, and when you graduate in a couple of years, Leanna, you're going to be able to say, I helped build a college. That's kind of crazy, right? Like that's a very unusual experience. And so I'm curious to know, could you, and you may never have thought about this before, but if you could think about it now, when you come back as an alumni, let's say 5 or 10 years after you graduate, what do you hope you see in the College of Health? What is it that what are you hoping to have develop in that time? It's a hard question, but I'd love to hear it say.
I think personally, I think that it's already like headed in that direction, but the interdisciplinariness of health, even like accounting and like population health. Like I think it's really cool to be in classes with people that are coming from all these different backgrounds, and you're hearing all these new perspectives. And I just hope that that continues. And with the development of new classes in the College of Health, like that's always taken into consideration.
That's great. Yep.
I would have to say the same thing. Just like seeing the different, even from when we first started, there are a bunch of like new classes that have been added. So I think it's like really cool to see like what new classes they can offer. Obviously, I know the College of Health is now partnering with College of Business. So I think that's a really great thing to get perspectives from different colleges as well. So
yeah, and I would just add to that, we have, we're collaborating in a programmatic way with the College of Business, and then we are also collaborating with engineering in a couple of ways. One is our associate dean for research is actually a bioengineer, and I asked him to serve in that role because he started our bioengineering department here and understands what it is to get a startup going. The College of Health is a startup. And so that's something that he is really tuned into, and he brings some expertise from his field, which is wonderful. And also we have a real focus on health innovation and technology that we've only begun to grow out in the College of Health. And so we have a colloquium series that starts actually next week. We have our first speaker in a series theme focused on health innovation and technology. So we'll have a speaker a month during the fall, and this will lead up to a spring search for a faculty member who will hold a named chair. So this is an endowed chair. It was endowed by Vince Forlenza, who's one of our wonderful alumni. And Vince Forlenza used to be he's a retired CEO of Becton Dickinson, the BD, which provides all kinds of devices and diagnostics and materials that help healthcare run. So we're going to be having this conversation about what does technology look like in the context of the College of Health, right? So it's awesome that people can create devices over in the College of Engineering, let's say, but what we can bring to the table is an understanding of how those devices can actually impact health for good, right? And you bring in the business angle too, then it's also what's the financial model for making such a device, reasonable. And then in the College of Health side, we also have health policy experts who can understand what policies would lead to an adoption of a really sort of life-changing device or algorithm or other kind of more technological kind of invention. So we have a lot of exciting things to look forward to.
That's fantastic. And I know you mentioned, again, interdisciplinary, all the different things you can study. And great question here by Rebecca about, is it a plus for College of Health students that they're able to do so many different things, that they're able to study different disciplines, that even if they may not be interested in a BS with the stat class and everything else, you're still welcome to do it. So Chrisana, would you like to answer that and tell us about your experience?
Yeah, so I guess I was very fortunate enough to, I think, be in the first population health class that they offered. I took it this summer after my sophomore year, so I think it was the very first time it was offered. And because of that, it was majority of people that had already declared majors in different programs. So we had engineers, I was in the College of Health, business students, people just from all different majors across campus already. And a lot of them were already upperclassmen. So there was no changing, no going back. And I think that definitely showed that you could be a part of any major or have any program and not want to take like every single like science class or social science class in the College of Health and still be a very strong candidate within the College of Health and still get a lot out of every single class that you did end up taking. So I do think that even if you did not want to do the full BS and you just wanted to do a BA, regardless of what your interests were, you'd be able to do them within the College of Health and still get as much out of it as any other student.
Yeah, that's great. And it's a good point that, we are very, encouraging of students to take classes in, not even necessarily for even a minor. It doesn't have to be for that, obviously be great, and not necessarily for a major, but students in with other degrees being able to take classes. Dean Dolan, would you like to expand on that a little bit?
Yeah, so I mentioned before that 64% of the students in our classes are actually from the other colleges right now. And that shows there's a lot of interest, and students want to have this in addition to whatever else they're doing, which is really smart, to add that kind of health focus. Or, for Chrisana, she had HMS, which is a great program. I was the founding director of that program, so I'm really fond of it. It's a very cool program, but it doesn't do data science, right? Like that's not a part of it. You get some epi, but you don't really get into the data science and the programming. And so adding that is really smart, because when you look at jobs, there's a lot of interest in data analysis, in the health field. I mean, data is sort of, I don't know, everything right now in a sense, in the job market. And so having at least the ability to understand the biostatistics, even if you're not the one doing the analysis, is important. And those skills are things that our students get in both majors, actually. So the BA is focused on community and global health and on culture a little bit more, but there are 3 methodology classes that students take. And you could do a data science heavy community and global health degree if you wanted to, or you could just become conversant and literate with the statistics and really lean into the cultural aspects. So that's an option. I think that most kind of intellectual progress happens at these borders between disciplines. So it's when you dip into one, you start to see the other a bit differently and can be really creative. And I think it's so exciting for students to be able to, be thinking about, let's say, determinants of health, and then also health policy at the same time, and understanding like how you might make an argument in terms of changing policy based in biostats, right? Like based in predictions. So Liana mentioned one of her favorite classes is biostatistics, and the professor that I would imagine that you had last year was Tom McAndrew. And so Dr. McAndrew's research is focused on predicting different aspects of pandemics. So he started with epidemics, right? Then he went big during COVID, but he actually was working on influenza and predicting influenza outbreaks. And if you change these variables, what happens, et cetera. And then he pivoted to COVID once COVID hit us, really. And has done incredible work that he actually contributes he contributes to the CDC's analysis. Students get to work on CDC data, as Leanna mentioned. It's very exciting. Yeah, and I think Chrisana mentioned work with Dr. Wakil, who has again, sort of a COVID project. Actually, it's a community resilience project around COVID, where she's looking at she's a maternal and child health specialist. So she's looking at mothers and children and how they're bouncing back, I guess, or not, from COVID, not just from actually having the illness, but from all the stress and worry, anxiety that has gone along with it for everyone, and particularly for people with children. So lots of exciting stuff.
Absolutely. I know we're coming up on the hour. So if there's any other questions that people really want to ask, now's the time to do so. I don't know if anybody, if either the students or Dean Dolan, you have anything that you'd like to add that hasn't been brought up yet that you think is important for everybody to know.
I would just invite everyone who is watching this, whether they're recording or live right now, to join us as we grow the College of Health. So one way you can do that is join our colloquium series, which Rick put up a link to. It's open, it's free, it's on Zoom, it happens at noon Eastern time. And so that's really convenient. Hopefully, even if you're at work, you can eat your lunch and watch the colloquium. Join us if you work in healthcare, reach out. If you have an opportunity for a student to have an internship, boy, we would love for you to offer that to them, even if it's unpaid. We can sort of try to figure that out. So that would be my sort of parting thought. I don't know, Leanna and Chrisana, do you guys have anything you'd want to say?
I guess my only thing is if you can be a part of the College of Health without doing a major in it, which I think is very helpful to a lot of students.
Yeah.
I can also add to that because last year I took my first population health course and I had friends that were in CSB majors. They were undecided. But I know that they all told me how helpful it was just to, I guess, kind of like see what the classes was like. Some of them want to do, even if they don't want to do like the BS or the BA, they want to do potentially do a certificate. So I know that's helpful just to take a class, see what it's like, and see how you like it.
Okay. Thank you guys so much. And thanks, Rick, for facilitating the question and answer. And thanks everybody who joined us. I think we will probably say goodbye now, but appreciate your time and look forward to future conversations with you.